Hello learners, today we are going to discuss about personality disorders. Under this we will first understand about what is personality and then we will discuss about the various disorders related to personality. So, what is personality? So, personality refers to the enduring and distinctive pattern of thoughts, emotions, motivations and behaviors that characterize an individual. Means it is not just a physique or figure of the person, it is not just shape of the person. Generally we understood it like if someone is overweight, we say that the person is healthy. No, that is not personality or healthy personality, that is not personality. Basically personality is consisting of thoughts, emotions, motivations and behaviors that basically unique to the individuals. So, these patterns are relatively stable over time. These patterns do not frequently change. The person who behaves in a particular manner keep on behaving in that manner and consistent across various situations, shaping a person's unique way of adapting to and interacting with their psychological and social world. So, there are various schools of psychology which defines a personality like Gordon Allport. Basically his perspective is based on the trait and core concept is dynamic organization and the definition focus on the internal psychophysical systems that cause unique behavior. Whereas Raymond Cattell his perspective based on trait and the core concept is based on prediction and definition focus on the set of traits that allow for predicting behavior. So, basically Cattell given 16 factors for personality and you all might be knowing that there is a test called 16 personality factor questionnaire. Everyone knows about Sigmund Freud, he has given about psychoanalysis, he talked about unconscious conflicts and he defined personality on the basis of the result of the battle between the id, ego and superego. I hope you all are aware about the id, ego and superego. Id is basically mostly unconscious and where all the repressed desires are there. So, but all these desires they want to fulfill. So, they want to come into the consciousness, but superego basically it is a moral aspect of the individual. So, superego generally do not allow such repressed material to come into consciousness. So, this is the job of the ego to find out the middle path of between id and superego. B.F. Skinner has given learning theory and his perspective is based on behavioral aspect of the personality and core concept given by him learned responses and definition focus on the a collection of behaviors shaped by environmental reinforcement. Carl Rogers his approach was humanistic and he has talked about self concept and the individual's perception of their real self and ideal self. So, basically Rogers talked about real self which we are basically no one knows about that and ideal self is basically what we want to project in front of others, what we want to show ourselves that we are like this. So, that is called ideal self. So, in some part of the real self is also we are not aware, the person who is about his own real self may not be aware. Albert Bandura, we all know that he has given social learning theory and he is talking about reciprocal determinism and he focuses on the interaction between personal factors, behaviors and the environment. So, he has given various explanation of the how the personality gets shaped by modeling or seeing the others behavior. Let us come to the personality disorder. So, what are the various personality disorders and what is personality disorders? So, personality disorders are mental disorders that develop early featuring enduring and maladaptive pattern of behavior, cognition and feeling. Means we all are behaving in a certain manner, we all are thinking, we all are having feeling, emotions, But in personality disorders, these patterns of behavior, thinking, feeling, they are maladaptive, they are not healthy. Then these patterns significantly deviate from expectation of an individual's cultural background and established social norms. So, whatever these maladaptive patterns are there, they are not matching with the social norms or the cultural background from where we are coming, they are deviant from those norms. So, you might have heard about the antisocial personality disorders. So, they say ki what society has given us, so why we should bother about the society, why we should care for society. Okay. So, their thinking, their emotions, their feeling, their behavioral patterns are totally mismatched with the social and cultural background. The maladaptive traits are exhibited consistently across a broad range of personal and social situations and are stable over time. It is not that the only in particular situation the person behave like that, the maladaptive patterns are seen in almost all situations and they cause significant dysfunction and impairment in personal, interpersonal, social and occupational areas of an individual's life. Means the person cannot feel happiness, much happiness, may always have some amount of distress. Whenever the person interact with others, may have some issues with him or others, and others may not feel comfortable in presence of that person who are having personality disorders. And it is very difficult to stay with the person for longer period of time, those who are having personality disorders. So, these disorders result in considerable distress for the person experiencing them and often for significant others in their life. So, let us see what are the impact of these personality disorders and how much they are prevalent in the society. So, the disturbance in the functioning caused by a personality disorders is similar to that of a major mental illnesses. For example, you can compare it sometime with the psychotic disorders. It is linked to higher rates of interpersonal difficulties like separation and divorce, unemployment, poor social functioning, a poor quality of life for patients and families and higher suicidal risk. So, in these people, those who are having personality disorders, they are having lots of difficulty for themselves, for others, for society, for families, for everyone, and suicidal risk is also very high in them. In developed countries, personality disorders are found in roughly 10 to 13% of the general population. Means out of 100 there might be 10 to 13 people who are having or suffering from personality disorders, and up to half of the psychiatric patient. Means those who are having psychiatric disorders, mental illnesses, among them you will find around 50% of them are suffering from personality disorder also. How to diagnose personality disorders? If someone's behavior deviate, it does not mean the person is having personality disorders. So, as per Diagnostic and Statistical Manual 5, there are certain diagnostic criteria which must be met, then only we can diagnose a person suffering from personality disorders. So, the one is chronic and pervasive pattern of behavior that affect social functioning, work, school and close relationship. Means if the person is affected with personality disorders, all these areas will be affected. Symptoms that affect 2 or more of the following 4 areas, for example, thought, emotions, interpersonal functioning, impulse control. So, at least 2 must be affected, like thought or emotions or interpersonal functioning. Onset of the pattern of behavior that can be traced back to adolescence or early adulthood. It means when the adolescent is having certain deviant behavior, it is difficult to diagnose personality disorder before the personality get matured, means before the age of 18, it is very difficult to diagnose. However, if you have diagnosed the person who is suppose of 25 years or 30 years old person, if you have diagnosed, so you will find all those deviant behaviors, maladaptive behaviors, thought, emotions, they developed during the adolescent stage or early adulthood. It means the changes in the personality is basically seen during the adolescent stage, which many of them develop adaptive pattern, but few of them fail to develop adaptive pattern due to various reasons, which we are going to discuss in next few slides. Then pattern of behaviors that cannot be explained by any other mental disorders, substance use or medical conditions, means whatever type of behavior the personality disorder persons are doing, it cannot be explained on the basis of mental disorder. Suppose they are suffering from schizophrenia, so then we cannot diagnose. If the behavior is related to schizophrenia, we cannot diagnose personality disorder. If the person is doing deviant behavior during the intoxication or while using substances, then also we cannot diagnose it. And if in certain medical conditions also personality disorder cannot be diagnosed until unless before the illness started it was there, then we can diagnose it. So, if we see the various personality disorders, they can be grouped into 3 categories: cluster A, cluster B, cluster C. So, cluster A basically is having those type of personality disorders where we see odd and eccentric disorders. Individuals exhibit odd and eccentric modes of speaking, are suspicious and have difficulty in relating to others. It is associated with schizophrenia. However, they have a better sense of connection with reality as compared to schizophrenia. Individuals with cluster A personality disorder have a higher probability to have a family member or first degree relatives with schizophrenia or any type of psychotic disorders. So, it shows that those who are having family history of psychotic disorders, so there might be a possibility that the coming generation may have some personality disorders or odd or eccentric behavior. So, there are 3 disorders coming under cluster A, and these disorders are paranoid personality disorder, schizoid personality disorders, schizotypal personality disorder. Under paranoid personality disorder, the pervasive chronic mistrust of others is the prominent symptom seen in this disorder. They doubt others' intentions, they do not believe in others. So, suppose the person get married, so it will be very difficult for the patient to believe the partner, to have faith in the partner. So, that way it will be a very much distressing for the partner, because the husband or the wife who is having paranoid personality disorder is not believing, always doubt the intentions, always suspect the partner. Another category is schizoid personality disorders. So, the main characteristic of a schizoid personality disorder is detachment from social relationship. So, they do not want to be in social gathering, they prefer to live alone. They feel discomfort, highly discomfort in social relationship, even though they are in gathering, they try to avoid others, they do not want to discuss, they do not want to mingle with others, they do not want to interact, they do not want to develop friendship with others. They are very cold and withdrawn and restricted emotional expressions. So, when they like, if you meet your friend, your friend will greet you with a smile, hello, hi, are kahan the, where you were, like that. But if you meet a schizoid personality disorder patient, even though he is in your class or she is in your class, the patient may not greet you with a smile, he may just say hello with flat affect. Another type of personality disorder is schizotypal personality disorder. So, in schizotypal personality disorder, there is a extreme discomfort interacting socially with distorted cognitions and perceptions. So, the cognitions could be distorted up to the extent to delusional level, but they are not at delusion, but they are so fixed and rigid, it will be very difficult to shake them, to change them or to counter them. And they have some difficulty with perceptions also, not sometimes hallucinations, but very fleetingly, not persisting for longer period of time, but sometimes other types of perceptual disturbances, illusions. So, all these things are characteristics of schizotypal personality disorders. They exhibit odd speech, behavior and appearance. It means if you meet them, you may find some oddities and you may not find them normal, and they often have difficulty in forming relationship and hold strange beliefs. So, the beliefs sometimes they share such beliefs, you cannot believe on such beliefs because they are strange. Coming to the another cluster, that is cluster B. In cluster B, the personality disorders, those who are having mainly dramatic and impulsive problems, such issues, they are clubbed into cluster B. So, individuals experiencing intense emotions and engage in extremely impulsive, dramatic, promiscuous or law breaking behavior. So, these are the core characteristics of this cluster B. So, let us see antisocial personality disorder, what is it? So, basically antisocial personality disorders means they are against the societal rules, they do not believe in society, they have disregard for rules and social norms, they do not believe in any rules, they basically prefer to violate others' right. Generally we respect others' rights, they do not, they try to violate others' right. They lack in empathy, they do not have empathy for others, they do not show remorse for their acts, means whatever act they have done, antisocial act, immoral act they have done, they do not have remorse, they do not feel guilty at all, rather they think whatever they have done, they have done good. For example, like an antisocial youth, the person tries to, and they are very good in making friendship, but they are very bad in maintaining those relationships. So, they what they do, they easily establish good relationship with friends with opposite gender, they exploit sexually, physically, financially, and then they live, and they do not bother, they do not feel that they have done anything wrong. So, this is the typical quality of antisocial personality disorder. Another personality disorder in this cluster is borderline personality disorders. So, this is pervasive pattern of dysregulation of emotion, instability in a relationship and problems in self image, and self harm is also very much seen in this group. So, basically they are feeling intense, they feel intense emotions which they fail to regulate. Generally, if we feel anger, we manage our anger. If we are attracted to someone, if we want to love someone, we manage it, we do not immediately respond impulsively. But in this group it is very difficult, and sometimes they are in a relation, if they are in a relationship, they are might be very possessive and demanding. So, if their desires are not fulfilled, they cut themselves, they do self harm. So, if you see the patient with borderline personality disorder, you might find lots of cut mark on their wrist, arms and other parts of the body. Another category is histrionic personality disorder. This is pervasive pattern of attention seeking behavior. Histrionic basically attention seeking behavior. So, if the attention is not given, they feel very discomfort, okay, and they are excessively emotional. They often use physical attractiveness to get attention. So, what they do? They spend lots of time in makeup, and they try to wear certain type of clothes. So, they want to attract others. So, others may pay attention to that person. So, that is the main thing in histrionic. Some authors say that histrionic personality disorder patients generally they show some amount of seductive behavior also. They like the way they talk, they interact, it is like they are seducing someone. So, fourth category in this cluster is narcissistic personality disorders. So, in narcissistic personality disorder there is a high need for admiration, they need admiration, pervasive pattern of superiority or grandiosity and lack of empathy. So, basically in narcissistic personality disorders they feel they are superior, they think nothing can be done without them, everything can be done must be done for them and must be done by them, for them, by them. So, this is like they must be in the center, and why? Because they are the most powerful, they are superior, okay, but they lack empathy. So, sometimes they are narcissistic personality disorders, they have some amount of sadistic trait also. Coming to the third cluster of the personality, that is cluster C. This cluster is basically consists of those who are having anxious and fearful traits. So, individuals experiencing excessive anxiety and fears and tend to involve in maladaptive behavior to reduce their anxiety. So, basically they are not harmful to others, they are not exploiting others, rather they are more or less anxious. So, some amount of anxiety. So, first disorder is anxious avoidant personality disorders, we call it avoidant personality disorders also, because they avoid the situation, they avoid social situations, because they find themselves they are not socially appropriate. So, they have pervasive feeling of inadequacy. So, if they are in a certain situation in a social gathering, they find themselves inadequate and there is lots of social inhibition. That is why they do not talk to others, because they think if they talk, if they open their mouth, others will know that he is inadequate, he is not a good person, or he does not know how to speak, or he does not have knowledge. So, such type of thoughts the person is having, and extreme sensitivity to negative evaluation. So, whenever such type of persons are in a social gathering, they always get thoughts कि everyone is evaluating, scrutinizing me, okay, and all these evaluation scrutiny is negative, no one is positively assessing. So, basically they are having this belief कि they are inadequate, they are inferior, they cannot face social situation because they are not polished. So, they avoid such situation. Another personality disorder is dependent personality disorders. So, here what the person does, person try to find someone on whom he or she can become dependent. So, there is a pervasive psychological need to be cared for by others. So, what happens for fulfilling this need, they do lots of sacrifices to please the others, to please those on whom this person is dependent, lots of sacrifice. Suppose two students roommate and one is having dependent personality disorders. So, what this person will do, this dependent personality disorder patient will do all the work of his roommate just to please, because he does not want to lose that person. Another category in this cluster C is obsessive compulsive personality disorder, or called anancastic personality disorders. So, we all know that what is obsession, what is compulsion. Obsessions are basically repeated thoughts, images or impulses which come again and again in our mind. We do not want them, but they come again and again against our will, and when they come they create lots of tension. And to reduce the tension, to avoid the tension, what we do? We have to do certain activities, rituals, behavior, that is called compulsion. Why? Because these compulsive behaviors, they reduces the tension from the which is created by thoughts. So, what happens in obsessive compulsive personality disorders? They hold rigid set of rules, are perfectionist to the extent of dysfunction. So, there is a difference between obsessive compulsive disorder and obsessive compulsive personality disorder. Okay. For obsessive compulsive disorder, there are certain criteria which must be fulfilled, then only we say. Here the person is otherwise doing well, doing fine, but in something he has certain issues or she has certain issues which cannot be managed by him. Let us see one case example. So, it will give you a good idea about the personality disorders. Miss M, age 32, single woman without a job, presented with depressed mood, suicidal thoughts and complete withdrawal from social life. She had spent the last 6 months alone in her apartment, lying in bed, eating junk food and watching TV. Her family includes parents and 2 siblings. Her elder sister is manager in a multinational company and younger brother is doing graduation. Her mother seems to value perfections and has shown dissatisfaction over her academic career and personal life. She felt alone through her school years and reportedly had no close friends. In college, she had fights with roommates and a professor. She reported that people take undue advantage of her and she has no trust on anyone, and that is why she kept herself distant from close relationship. M sometimes cut herself when she feels empty and depressed. Occasionally, she would act on impulse with great risk of her safety by involving in drug abuse and reckless driving. She feels better for short term after doing these impulsive acts. She could not stay at several previous jobs due to interpersonal conflicts with either boss or colleagues. M was found to have problem with anger control, impulsive acts, self-harm such as cutting, feeling empty and depressed. So, this story, this case example is giving idea about that the person is suffering from some type of personality disorder. So, if you do the detailed workup, detailed history taking and assessment, you will find that in this case it was found that she was diagnosed with borderline personality disorder with major depressive disorder. So, depression is very common in personality disorder. Let us see what are the various causes of personality disorders. So, we know that any illness is basically due to biopsychosocial factors. So, here is also same thing is applied, like genetic factors, environmental factors and certain personality factors identified as important contributors. In personality disorders, genetic factors and environmental means consisted of social or cultural factors. So, they play very much role in having personality disorders. So, what the things we get in the history? We find history of childhood trauma and abuse. So, those children who were abused during their childhood, they may develop trauma or may face trauma and abuse. So, when they grow older, they may develop personality disorder. Exposure to physical or sexual abuse or neglect. So, not by sexually exploited, if they have seen such sexual abuse or if they are neglected by their parents, parenting was not good. So, parenting style which involve low warmth, hostility, harsh punishment, then low socioeconomic status, stressful life events and family adversities, high level of negative affectivity and impulsivity, in some cases low IQ is also seen. So, these are the causal factor of PD. If we have to see the treatment, what type of treatment can be done? So, the goal of the treatment must be like reducing subjective distress and symptoms such as anxiety and depression and modifying certain behavior like self harm, insight facilitation Like the therapist or the psychologist job is to try to develop insight into the patient by using certain techniques and certain examples, self observation, okay, all these things, because they lack insight. Changing maladaptive behavior. So, whatever maladaptive behavior they are doing, by using behavioral technique it can be changed. Addressing interpersonal difficulties and improving quality of life. So, these are the treatment goal. Whatever type of therapy you are using, you keep all these goals in your mind. So, let us see, there are various treatment approaches, and but remember one thing, no short term psychotherapy will be helpful in personality disorder. So, we need long term psychotherapies. So, there is one therapy called dialectical behavior therapy given by Marsha Linehan, specifically developed for borderline personality disorder, uses a biopsychosocial model to understand the development of personality pathology, and uses a number of cognitive behavioral strategy in therapy. It teaches coping methods for handling urges related to self harm and suicidal behaviors. It includes skills for mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. Another therapy called schema therapy given by Young et al. Incorporates concepts from attachment theory, cognitive behavior therapy, and Gestalt therapy. The main focus is to address early maladaptive schemas and dysfunctional schemas modes rooted in early adverse childhood experiences. Early maladaptive schemas can be defined as stable, trait-like enduring beliefs about oneself and the world that are rooted in early adverse childhood experiences. Mentalization based therapy MBT given by Batman and Fonagy. So, mentalization refers to the process by which we make sense of others as well as ourselves. Teach people to notice and reflect on their internal states of mind and those of others. The therapy aims to stabilize emotional expression and reinstate mentalizing abilities. This is psychoanalytic based therapy called transference focused therapy, a psychoanalytic therapy for severe personality disorders based on object relation theory. Dominant object relations are addressed within the transference relationship of therapy, and the split between the idealized and persecutory part of the object is addressed in order to foster the development of normal identity. So, to conclude and to see the future direction, most therapies are largely tried out in borderline personality disorder, where there are no much therapies tried on other personality disorders, while their application and study in other personality disorders remain significantly underexplored. A clear need exists to establish the effectiveness of these therapeutic approaches for a broader range of personality disorder beyond just borderline personality disorder is required. So, thank you all.